The Eastern Cape healthcare system is crumbling under the pressure and the demand for beds, with many health facilities on the brink of collapse, a problem that was anticipated. This facility, the brainchild of health authorities, VW South Africa and the German government, will relieve some of the pressure.
For the holistic plan that you have worked on, that has ultimately delivered this very successful project, which has got quite a lot of implications, because as you have heard, it's a project that consists of the infrastructure, which is about creating the hospital beds, field hospital beds, and at the same time is also supporting our laboratory testing capability, supporting the National Health Laboratory Services.
A field hospital destined to help save lives.
A total of 3,300 beds coming along with oxygen reticulation. All of this is a very important combination of what our needs are at this point. This has been now established within a record time.
This field hospital will provide 3,300 beds when fully operational. It plays a vital role in the fight against COVID-19 as traditional hospitals in the Eastern Cape are reaching capacity. But this 66,000 square meter building was never envisaged to be a healthcare facility. It was originally built as a car factory. History will from now on view it differently. 1,400 beds will be available during the first phase. Staffing the facility is being prioritized.
It shall actually take off the burden of a accommodation which is so highly needed in the area of Nelson Mandela. So it shall provide some kind of isolation to the patients that are going to be here. So in a sense, you are looking at us now having engaged 5 doctors and 40 nurses. And as the phases go on, because today we're launching only the first phase, as the phases go on, the continuation of the employment of such staff is ongoing, already signed.
The German government donated 107 million rand for the building of the hospital through VWSA.
We are hopeful that these beds will be sufficient in providing support to our public health institutions to deal with the expected patient overflow at the peak of infections. The other portion of the German government's grant funding was for the procurement of personal protective equipment for local public hospitals, local primary healthcare clinics and COVID-19 test centers.
A symbol of hope for many in the midst of the pandemic. The Department of Health is expected to operate the facility until March next year. Rwanda Nomoyi, SABC News, Port Elizabeth.